Good morning, everybody. I'm Stephanie Haney. As promised, I'm here with your 11 a.m. daily update about what's going on with the COVID-19 coronavirus here in the state of Ohio. To give you a recap about the information that we got yesterday from the Ohio Department of Health when they released those numbers at 2 p.m., here's where things currently stand. We have 867 confirmed cases of the COVID-19 coronavirus here in the state of Ohio. It's spread across 91 counties for sure at this point, possibly more. Dr. Amy Acton, the head of the Ohio Department of Health, says that our testing is not up to speed with how far the virus has spread, but these are the confirmed numbers that we have right now. There are currently 233 hospitalizations related to the COVID-19 coronavirus, and we've had a total of 15 deaths as of 2 p.m. yesterday. The age range of people impacted is less than 1 year old, all the way up to 94 years old. And the median age, if you lined all of those people who have been confirmed as positive with COVID-19 coronavirus, if you lined them all up, the very middle person would be 51 years old. And so far, of the confirmed cases, 53% of those cases are male and 47% of those cases are female. We know a lot of people are paying a lot of attention to that economic stimulus package, that $2.2 trillion economic stimulus package that passed through the Senate. They voted on it, and it did pass unanimously. It's now up for a vote in the House of Representatives. That was expected to take place today via a voice call, which meant that the representatives would not have to actually be present in Washington, D.C. in order to take that vote. However, there's a little bit of a snag this morning. Representative Thomas Massie from Kentucky is thought to possibly want to call the vote to actually be required to be physically present at the House of Representatives in order to do it. So lots of people rushing back to Washington, D.C. to be there so that it's not delayed and the vote can be still taken today. But a lot of people not very happy about this. Representative Peter King, for one, from New York, tweeted this: heading to Washington to vote on pandemic legislation. Because of one member of Congress refusing to allow emergency action, entire Congress must be called back to vote in the House. Making a point to note the risk of infection and risk of legislation being delayed, with Representative King calling this both disgraceful and irresponsible. So we'll be continuing to monitor what happens with that vote in the House of Representatives today. Speaker of the House Nancy Pelosi did speak yesterday, and she said she expected it to pass quite simply today. However, we'll see how that is maybe jumbled up a little bit if an actual vote presently is called and they're not able to do it by voice vote. Some more surprising news from across the pond. United Kingdom's Prime Minister has tested positive for COVID-19 coronavirus. Prime Minister Boris Johnson said on Twitter that he started developing mild symptoms before it was confirmed and is now in isolation and will be addressing the country via video conferencing from here on forward while he needs to participate in that isolation in order to protect others and stop this potential spread of COVID-19 coronavirus. Here in the U.S., we now lead the world in number of cases of COVID-19 coronavirus. This is according to Johns Hopkins University. We have more cases than any other country in the world. That's including China. That's including Italy. As of 4 a.m. Eastern Time, the U.S. had 85,991 cases. That number is going up by the moment. We know that we expect those cases to continue to grow. Dr. Amy Acton in her press conference yesterday said when we hit the peak here in Ohio, we can expect as many as 6,000 to 8,000 new confirmed cases a day. And she said it's possible we may not hit that peak until early May. Again, that's per day, Dr. Amy Acton. Even with all of the preventative measures we're taking here in the state of Ohio, with people around the country recognizing that Ohio is really leading the way and being proactive and taking these precautionary measures, at its peak, Ohio is expected to have as many as 6,000 to 8,000 new cases of COVID-19 coronavirus every day. Worldwide, taking a look at the numbers, there are more than 530,000 cases, 24,000 deaths, And here's an important number to keep in mind as well. There are also 122,000 recovered individuals. That's important to keep our sights on as we move through this new normal, as we figure out how to handle this pandemic, as we do our best to flatten the curve, as we listen to the experts and stay home when we don't need to be out, if we're not those essential workers, if we're not doing those essential things like getting groceries, getting gas, getting medications, taking care of family members, those kinds of things. And of course, as we are maintaining our physical distance of 6 feet when we do need to go out and do those things, when we do need to go out and get our fresh air. So worldwide, 122,000 people recovered, keeping in mind that the majority of the cases won't escalate to the most severe, but these are all things that we do need to keep in mind. All right, that's your COVID-19 coronavirus update for now. We expect to hear from Governor Mike DeWine again later this afternoon. I will be back here at 2 p.m. with your update as soon as we get those new numbers from the Ohio Department of Health. I'm Stephanie Haney. I'll see you back here in a little bit.